My insurance company denied my surgery on a Tuesday morning. The letter said it was not medically necessary. My surgeon had submitted 47 pages of documentation saying it was. So I did what any normal person would do. I requested their internal audit records going back 3 years. And what I found in those records is the reason that 3 executives no longer work there. Let me take you back about 18 months. I'm a medical billing compliance analyst, have been for 11 years, which basically means I spend my days going through healthcare billing records looking for errors, inconsistencies, patterns that shouldn't be there. I'm good at it, like genuinely good. My job is essentially being the person that insurance companies hire to find problems. Except in this case, I was on the other side of the table, and I was the problem they hadn't seen coming yet. The surgery itself was for a pretty serious spinal issue, L4-L5 disc herniation that had gotten bad enough that I was losing feeling in my left leg. My orthopedic surgeon, Dr. Renata Aukafer, had been monitoring it for 8 months. She'd tried the conservative route, physical therapy, injections, the whole thing. None of it worked. So she submitted a prior authorization request to my insurer Meridian Regional Health Plans in early February. The submission was 47 pages. Imaging, clinical notes, failed treatment documentation, everything. I know because I helped her office format it. And then I waited. 3 weeks. And the denial letter hit my mailbox on a Tuesday at 11 a.m. I remember because I was eating lunch at my desk when I heard the mail slot. The denial letter was signed by a Dr. Marcus Elroy, listed as Meridian's Regional Medical Director for prior authorization review. The reason given was 4 words. Not medically necessary, conservative treatment recommended. That's it. No specifics. No engagement with the 47 pages. Just conservative treatment recommended. As if Dr. Aukafer hadn't spent 8 months documenting exactly why conservative treatment hadn't worked. I called the appeals line. Got a rep named Brittany who sounded like she was reading from a laminated card. She told me I could file a level 1 appeal within 30 days. I asked to speak with Dr. Elroy directly. She said, Dr. Elroy doesn't take calls from members. I said, I work in medical billing compliance. Can you tell me what clinical criteria Dr. Elroy used to make this determination? She paused, and you could hear her kind of recalibrating. And then she said, I'm not able to share that information at this time. I wrote down the exact time, 1:47 p.m. I wrote down her name, and I filed the level 1 appeal that same afternoon. The denial came back in 11 days. Faster than average, actually. Same language. Not medically necessary. I sat with that for a minute. Then I pulled up my state's insurance commissioner website and started reading. Here's what most people don't know, and what Meridian was clearly counting on nobody knowing. Every state-licensed insurance provider is required under federal law, specifically under the ACA's internal appeals regulations, to provide a claimant with a full copy of all documents, records, and other information relevant to the adverse benefit determination. Upon request, in writing, within 30 days. I submitted that request on a Monday morning, certified mail. I also submitted a simultaneous request under my state's insurance code, Section 382136, if you want to get specific, for Meridian's internal clinical criteria documentation for spinal surgery authorizations. That's the rubric Dr. Elroy supposedly used. I wanted to see it, all of it. Then I called my HR department at work and asked about our company's self-funded plan administrator. Turns out my employer used Meridian as a third-party administrator, which meant there was a whole separate layer of oversight I could loop in. Our HR director, a wonderfully no-nonsense woman named Carol Sims, picked up the phone and said, They denied you. For a spine surgery your doctor's been pushing for 8 months. I told her what I'd filed. She got quiet. And then said, Keep me in the loop. I said I would, and I meant it. So I did exactly what the process allowed me to do. I waited for the documents. They arrived, or rather, part of them arrived on day 29. A USB drive. 41 pages of clinical criteria guidelines, heavily formatted, lots of bold headers. It looked thorough from a distance. But I do this for a living, and the first thing I do with any document package is check what's missing. What's referenced but not included? What's redacted and why? 3 of the footnoted clinical sources cited in Elray's criteria document were studies published after my denial date, which is a neat trick if you can pull it off. They were using criteria that, technically speaking, hadn't been finalized yet when they denied me. I flagged that. Wrote it in a separate document I'd started keeping, just a running log, timestamps, page numbers, cross-references. Neat and very boring looking. Like a spreadsheet that wanted to be a weapon. I also noticed something in the billing records they'd accidentally included. A batch reference code, AURX 2271, attached to a cluster of prior auth denials across a 3-month window. 44 denials. Same diagnostic range as mine. Same reviewer initials, ME44, in 90 days. I sat on that number for a little while. So I submitted a second records request. Specifically for all prior authorization determinations under reviewer code, ME, for spinal procedures from January through December of the previous year. I cited the ACA, I cited section 382136, and I mentioned, very casually, in the last line, that I'd noticed reference batch AURX 2271 in the materials already provided and wanted the related determinations for context. The response took 4 days, which in insurance bureaucracy terms is basically someone running. They sent a letter saying the additional records weren't covered under my original request. I expected that. I filed a formal complaint with the state insurance commissioner the same afternoon, specifically citing the denial of records relevant to a pattern of adverse determinations by the same reviewer. That complaint number IC 2024-892, if anyone wants to go look, triggered a mandatory 30-day response window from the commissioner's office. And here's where it got interesting, because while I was waiting on that, Carol from HR had been doing her own digging. She called me on a Thursday and said, "So I talked to our plan consultant, and apparently we're not the only employer group with Meridian complaining about spinal auth denials right now. 2 other companies on our same regional plan had flagged similar patterns through their HR departments. Carol had connected with their benefits coordinators, and between the 3 companies, they were looking at 61 denied spinal procedure authorizations in a 14-month window, all in the same region. Significant overlap in reviewer initials. I asked Carol if she'd be willing to put that in writing to the commissioner's office. She didn't even hesitate, already drafted it, she said. I just needed to know if you minded being named as the one who flagged it first. I told her to go ahead. Which would have been satisfying enough on its own. Except 2 weeks later, the commissioner's office responded to my complaint and informed me they were opening a broader inquiry into Meridian's regional prior authorization review process. Not just my case, the whole regional department. They requested 3 years of records. 3 years. My Level 2 external appeal, which I'd filed alongside all of this, because why not, the clock was running, came back approved. Independent reviewer. Different physician. Looked at Dr. Aukhaffer's documentation and approved the surgery in 6 days. 6 days versus the 8 months Meridian had dragged it out. I got a call from a Meridian representative 2 days after that. A different person this time, not Brittany, not anyone from appeals. Someone from their member relations team, very measured voice, who told me they wanted to discuss my experience. I said I appreciated the call and asked if it was being recorded. She said yes. I said, "Great, so is this one." Then I told her I had nothing to say to member relations and that any further communication should go through the commissioner's office. She said, "Of course," and she hung up first. I could hear it in her voice, that specific kind of professional calm people use when they're reading from a crisis communication script. The surgery happened 6 weeks later. Dr. Aukhaffer fixed the disc. I did rehab. The feeling in my leg came back. That part's great, obviously. That part's the whole thing, really. But here's the rest of it. The commissioner's inquiry found that Dr. Marcus Elray had approved or denied prior authorization requests at a rate that was statistically inconsistent with peer reviewers at comparable regional plans. Specifically, his denial rate for spinal procedures was 340% above the regional average. Meridian was fined $2.3 million by the state for systematic violations of prior authorization review standards. Dr. Elroy's name disappeared from their medical director page sometime around month 4 of the investigation. 2 other administrators in the regional billing department left within 6 months. Carol told me the employer group renegotiated their entire plan contract. And my surgery, which was not medically necessary, Meridian paid for it in full, every cent, plus the cost of both appeals, plus the independent reviewer fee. All because I requested the documents they were legally required to give me. All because Brittany told me Dr. Elroy didn't take calls from members. And all because, and I want to be very clear about this, I do this for a living. They just forgot to ask.